We have Catherine CVA with AARP, Steve Edmonds with Alliance Insurance Services answering your Medicare and other health-related questions. All right, Steve, we've gotten a couple of these. I continue to receive emails that I can get $3,000 per year for groceries because I'm on Medicare. With so many scams going around, I don't know if this is true or not.
So there are Medicare Advantage plans that will offer some of those benefits where you will have you can buy groceries and stuff like that. These plans are called D-SNPs, and that means if you're dual eligible, if you're eligible for both Medicare and Medicaid, then you likely would qualify for one of these D-SNP plans. And if you do, yes, you likely would get some of these benefits that you're asking about here. Yeah.
Okay, but you probably need to call and talk to someone to make sure that you're not offering any other kind of insurance coverage that you have.
Right, right. And these type plans are only offered through Medicare Advantage plans.
Okay, gotcha. All right, so we have a couple questions, Catherine, about whether Medicare pays for certain things. Do they pay for COVID tests?
Yes, they do if you are symptomatic. They may not pay if you just are curious, but if you go in and you're sick or having symptoms, they'll pay.
How about, does Medicare pay 100% for mammograms?
Medicare does pay for mammograms. That's a covered service. They are looking at the frequency of that, and right now they seem to be still paying on an annual basis, but there is some look at expanding that to every 2 years, so that's being thought about.
Okay, and then the third one, can I get a Medicare dental plan?
There is not such a thing, except, and Steve, you may want to talk about that with Medicare Advantage.
Right. So if you're doing a Medicare supplement, there is no dental, vision, or hearing on the Medicare supplement. If a person has a Medicare Advantage plan, however, there are all those things. So they are dental. There is dental, vision, and hearing. Most of the dental benefits range between $1,000 to $2,000 benefit per year. The hearing, it'll cover hearing exams, it'll cover vision exams. So Medicare Advantage, they offer a lot of perks with those type plans. It's not quite as rich of medical coverage, but you do get dental, vision, and hearing for sure.
Okay, and you'll just have to weigh that and see if what the cost for that is worth it for you. Catherine, this person's asking, are veterans fully covered by Medicare?
Veterans are covered by Medicare. If someone's service connected and getting their care at the VA, they need to work with the VA and Medicare together to make sure that all of their care is covered. So they want to talk with their representative at the VA if they're getting care there.
All right, Steve, this person says they enrolled in Medicare a month ago, but they haven't received their card. They say they're sending another one. Should I be worried about this?
I personally would not be worried. I'm working with a lot of clients right now that applied for their Medicare like over 30 days ago. So in some cases, it's taken 45 and 60 days. And the moral of that story probably is if you're entering your gateway to where you're getting Medicare turned on, say November 1st or whatever, I mean, go ahead and start working on it now. I mean, you can work on it 3 months ahead of time. So why not? Yeah.
We're going to try and get 2 questions in. Catherine, open enrollment starts when?
October 15th, and it lasts till December the 7th this year.
And that's if you want to make some changes for your Medicare plans from one year to the next.
Absolutely, or change your supplements.
All right, and Steve, one thing about Medicaid that you wanted to talk about.
Okay, so for folks that are on Affordable Care Act plans, there is a thing going on now called Medicaid unwinding, and that just means that the federal government expanded Medicaid benefits back during COVID. A lot of that money is running out now, and if you get notified that you're no longer eligible for Medicaid, you have an eligibility for a special enrollment period, and that runs for 60 days from the time you were notified. Very important. You don't have to go without coverage. You can come on in and get signed up for an Affordable Care Act plan.
Okay, got it. All right. We got a lot of stuff in. We thank you for your time and your expertise. If you missed anything, it's in the Two Wants to Know section